On March 3rd, 2020, WHO presented different guidelines for persons, particularly for those persons who are diagnosed with non-communicable diseases, and they consider that those people are susceptible to develop the COVID-19. So they have segregated two different types of people: those which are affected with non-communicable diseases and those which are at the risk. So there are a number of people, for example, those people which can be affected with the COVID-19, mostly elderly people having an age of 60 plus, and the people which are facing pre-existing non-communicable disease. Like there are a number of diseases they have considered, like CVDs, in the diabetes and cancer. On the other hand, the risk factors, they have mentioned certain risk factors for the people who could be considered as the people which are vulnerable to become severely ill with COVID-19. So the first I will talk about the smokers are particularly likely to be more vulnerable to COVID-19. Possibly because it's a respiratory syndrome, so most of the time it is considered that most people who are habitual smoker, they are more vulnerable to the COVID-19, and the conditions that normally increase the oxygen needs are we can say that they can reduce the ability of the body to use it properly, will put patients at high risk of the COVID-19.